So our next topic is tinnitus. We already learned about Karnanada, Karnashveda and all. So we are comparing that to tinnitus. So tinnitus is nothing but a ringing sound inside the ear. So a tinnitus is a ringing sound or noise in the ear. The characteristic features is that the origin of this sound is within the patient. So the characteristic feature of tinnitus is that ringing sound or any other noise the patient is hearing is from inside him, not from the outside. Normally we will hear the sound from outside, right? This tinnitus, that condition, the patient can hear a sound that is from inside. Usually it is unilateral but may also affect both the ears. Usually the patient who are coming to us is telling that it's a unilateral, only one ear will be affected but may also affect both the ears. It may vary in pitch and loudness and has been variously described by patient as roaring, hissing, whizzing, rustling or clicking type of noise. So it may vary in pitch and loudness. The loudness and pitch vary in different patients. In different patients, different types of tinnitus or sound can be heard in different loudness or different pitch. The patient, for example, the sound resembles roaring, hissing, whizzing, rustling or clicking type of noises. These type of noises can be heard inside the head. Tinnitus is more annoying in quiet surroundings, particularly at night when the masking effect of ambient noise from the environment is lost. So it is more annoying in quiet surroundings, right? So whenever there is no noise around the patient, then it will be more evident for him. So it at that time it is especially in the night time, particularly at night while going to sleep, the patient will get that noise inside his head. It's not it's especially because the outside noise will be less at that time. So at that time, so night time while going to sleep only, this will be more. The patient complains at that time it is more. Next comes the types of tinnitus. There are two types of tinnitus, subjective and objective. So subjective tinnitus is the tinnitus which can only be heard by the patient. The subjective tinnitus can only be heard by the patient. And the objective type, it can even be heard by the examiner with the use of a stethoscope. By using a stethoscope, even the examiner can hear that sound. That is objective. So subjective, only the patient can hear. He can tell us. We can't find out. We can't hear that sound. That is subjective tinnitus. And second one is objective, that the examiner can hear using a stethoscope. These are the two types of tinnitus. So tinnitus is nothing but the ringing or noise inside the ear. It is mainly unilateral. Sometimes it can affect both the ears, and it will be hissing, rustling, whizzing, hissing. All those sounds can be, or clicking sounds can be heard inside the ear. Mostly it is seen during night time when the surrounding sound is not present. At that time mostly heard, and it is of two types, subjective and objective. Subjective type is only heard by the patient, and objective type is that the examiner can also hear if he is using a stethoscope. Next comes the causes of tinnitus, that can classify into subjective, objective and psychogenic. So subjective causes are, it may have its origin in external ear, middle ear, inner ear, eighth nerve or central nervous system. So the subjective tinnitus may occur because of the pathology in external ear or in the middle ear or in the inner ear on eighth nerve. Eighth nerve is vestibulocochlear nerve or the central nervous system. Any pathology in the central nervous system can also cause tinnitus. Or else, systemic disorders like anemia, atherosclerosis, hypertension, and certain drugs may act through the inner ear or central auditory pathways. So, it not only this diseases in the ear, the outside, the systemic disorders like anemia, atherosclerosis, hypertension, and certain drugs that may act through the inner ototoxic drugs or the central auditory pathways, that can also cause tinnitus. In the presence of conductive deafness, the patient may hear abnormal noises in the head during eating, speaking, or even respiration. So, conductive deafness is deafness occurred due to a problem in the conduction of the sound. In the conduction of the sound, if there is any problem, then it is leading to deafness. In those conditions, the patient may hear abnormal noises in the head during eating, speaking, or while even during respiration. So these are the causes for subjective tinnitus. So the pathology can be in external ear, middle ear, inner ear, or eighth nerve or central nervous system, or due to systemic disorders like anemia, hypertension, or atherosclerosis, and also due to some drugs that will affect the inner ear and the central auditory pathways, and also due to especially in the conductive deafness, there will be tinnitus, especially during eating, speaking, and respiration. Next comes the objective tinnitus. The causes for objective tinnitus are it's a less frequent. Objective tinnitus is less frequent, and it may be due to vascular lesions. Vascular lesions means lesion in the blood vessel. So glomus tumor or carotid artery aneurysm. So glomus tumor can occur in carotid artery or in the middle ear or the below portion of the middle ear. So here the tinnitus is a symptom of a glomus tumor in the middle ear. So in the middle ear, if a tumor is there, then it can cause a vascular lesion, tinnitus, or in carotid artery aneurysm. Aneurysm of the carotid artery can also cause tinnitus, and that causes swishing tinnitus synchronized with the pulse. So it will synchronize with the pulse. Along with the pulse, it will be there, that tinnitus. Swishing, that sound is swishing sound, and it can be temporarily abolished by pressure on the common carotid artery. So if we give a pressure on the common carotid artery, this will released, this will stop. So it is mainly due to glomus tumor or carotid artery aneurysm. So if we give a pressure on this carotid artery, then it will stop, temporarily stop. Then venous hum can sometimes be stopped by pressure on neck vein. If we give a pressure on neck vein, venous hum, that is also another type of tinnitus, that will also get stopped. This tinnitus synchronized with the respiration. Tinnitus synchronous with respiration may occur due to abnormally patent eustachian tube. Eustachian tube, you know, right? It will connect the middle ear to the oropharynx. So backside of the nasopharynx. So that patency, that abnormally patent eustachian tube also will cause a tinnitus that will be in sync with the respiration. And also palatal myoclonus, that produces clicking sound due to clonic contraction of muscles of soft palate and can be easily diagnosed. So palatal myoclonus, it produces a clicking sound due to clonic contraction of muscles of soft palate. So palatal myoclonus is nothing but the spasm of the palate muscles. So of soft palate, there are muscles, so there is a spasm of those muscles, and that will lead to a clicking type of tinnitus in the ear, and it can easily diagnosed. This clonic contraction can also happen inside the muscles of middle ear. Inside the middle ear, there are some muscles, so stapedius and tensor tympani, they are very small muscles, and spasm of that will cause clonic contraction of muscles of middle ear, and that may cause tinnitus, which is often difficult to diagnose because it is inside the ear and it is very small. So that can also cause tinnitus. That is objective type of tinnitus. So these are the causes for objective type of tinnitus. So we here some vascular lesions like glomus tumor or carotid artery aneurysm, and also this abnormally patent eustachian tube or palatal myoclonus, and clonic contraction of muscles of middle ear. All this can lead to objective type of tinnitus. Sometimes tinnitus is psychogenic. This is the third cause, psychogenic cause. So here the tinnitus may be psychogenic and no cause can be found in the ear or central nervous system. If it is a psychogenic tinnitus, we can't find any problem pathology in the ear or central nervous system or any other systemic diseases, there we have to differentiate it from auditory hallucination. So tinnitus should be differentiated from auditory hallucinations in which a person hears voices or other organized sounds like that of a music. It's seen in psychiatric disorders. In psychiatric disorders like schizophrenia and all, there will be auditory hallucination. That time the patient will tell, I can hear a sound, I can hear a music. That is auditory hallucination. That is not tinnitus. So we have to differentiate that in psychogenic causes. So these are the causes of tinnitus. So there are subjective cause, objective cause, and psychogenic causes. So this table explains all causes of tinnitus. So subjective can be divided into autologic and non-autologic. That means autologic means that is inside the ear, and non-autologic means other part of the body. So autological causes for tinnitus are impacted wax fluid in the middle ear, acute or chronic otitis media, that is infection in the middle ear, abnormally patent eustachian tube, Meniere's disease, autosclerosis, presbycusis, noise trauma, noise pollution, autotoxic drugs, so that drug which is not good for ear, tumors of eighth nerve. All those things are the reason from the ear to cause tinnitus. And non-autologic reasons are disease of the CNS, central nervous system, anemia, atherosclerosis, hypertension, hypotension, hypoglycemia, epilepsy, migraine, and some drugs. So these are the subjective cause, and objective cause already we discussed: vascular tumors of middle ear, glomus tumor, aneurysm of carotid artery, and palatal myoclonus. And the third one is psychological, psychogenic. Treatment. Tinnitus is symptom and not a disease. Like we told in otalgia, it is a symptom, not a disease. So wherever possible, its cause should be discovered and treated. The cause should be discovered and treatment should be given according to that. Sometimes even the treatment of cause may not alleviate tinnitus. Sometimes if we give the treatment for the cause, then also this won't alleviate. When no cause is found, management of tinnitus include. So when no cause is found and we are not able to manage the situation, then we have to give the below treatment: reassurance and psychotherapy. So we have to give the assurance to the patient and educate them about the disease and all. And psychotherapy should be, many times the patient has to live with tinnitus. They have to live with the tinnitus for lifelong. Techniques of relaxation and biofeedback should be given. So relaxing techniques like a yoga, meditation, like that we can ask them to do, or biofeedback, that is nothing but there are therapies according to the involuntary actions of our body can be monitored, and relaxation techniques should be given to them. Like if a blood pressure, increased blood pressure patient, or if their pulse are increasing, they used to ask them to wear an instrument to monitor that, in which situation it is going high and which situation it is coming less, and all that we study, and according to that we will ask them to listen to music, all those things. That is biofeedback. So that also we can ask a tinnitus patient to go through. And the third method is sedation and tranquilizers. That is usually given in initial stage where the patient is not adjusted with this tinnitus. It's a very irritating situation if you are sitting silently and from inside our head there is some sound that is like a insect buzzing or a clicking sound and all hearing. It is a very irritating condition for a patient. So at first it is very difficult to adjust with that. So at that time we can give sedation and tranquilizers. Masking of tinnitus. Masking of tinnitus is more annoying at bedtime when the surroundings are quiet. So at that time we can ask the patient to use a fan, a loud sound, or loud clicking clock, or a similar device that may mask the tinnitus and help the patient to go to sleep. And use of hearing aid in patients with hearing loss not only improves hearing but also provides a masking effect. And also tinnitus maskers can be used in patients who have no hearing loss also. They are worn like a hearing aid, but it is nothing but a tinnitus masker. and use of tinnitus maskers for a short time may provide in some individual a symptom-free period for several hours due to phenomenon of residual incubation. If they are using a mask for a short time, it may give some for a several hours a symptom-free, because before that we use this mask. So because of the residual incubation, that phenomenon for some time, several hours, it will be a symptom-free period for the patient. So that is the tinnitus maskers. So that is about the treatment for tinnitus, and the main thing is we have to give a treatment for the cause. Then comes this is about tinnitus. So we learn tinnitus, its causes, and its a treatment. Hope you all understand what is a tinnitus. Thank you.